Thank you for this opportunity to present my work here. So it's about corneal lymphadiogenesis, which means the formation of new lymphatic vessels. The lymphatic system has three major functions: immune response, that's where my research focuses on, and tissue fluid regulation, and also the fat and vitamin absorption from the digestive system. So its dysfunction has been discovered in many diseases, such as cancers, metastasis, and also the lymphedema as primary and secondary lymphedema. Also in AIDS patients, the Kaposi sarcoma is a disorder of the lymphatic endothelium, and also in obesity, and also in transplant rejection. This is a slide from the rejected kidney transplant. So it's in the autopsy study, there's a 50-fold increase of the lymphatic vessels in the rejected ones. And this is a table from a review paper I wrote about 5 years ago. So it summarizes the eye diseases associated with lymphatic disorders, so such as in corneal transplant rejection, infection, this is a virus infection, and chemical burns, in dry eye, melanoma metastasis, and also recently we found the Schlemm's canal of the aqueous humor outflow pathway is a lymphatic vessel. So it can, this is a lymphedema, so it can occur independently just to the eye or be part of systemic syndrome. So this is a conjunctiva and this is a face, and as demonstration here. So these slides kind of summarize what we have done in my lab in UC Berkeley during past few years. So the model system we used is transplantation. So we do corneal transplantation, also bone marrow transplantation. So we do implantation and also inflammation. So we do in vitro, in vivo, and also in real-time study. So the strains we use is normal mice and also knockout and various transgenic mice. So we study the mice from the embryonic stage all the way to adult stage. And also we study the stages of lymphagenesis from the early to late stage. So we study the ocular surface, including the cornea and also conjunctiva tissue. So we, my lab also found that in addition to the lymphatic structures, we also identify inside the lymphatic vessels there is a formation of these valve structures. So we study the valves too. We also study the cell interactions between the vessels and macrophage and dendritic cells. And also we try to identify what cell population actually contribute to the formation of lymphatic vessels. So a major direction is to try to localize and identify the molecular pathways involved in lymphadegenesis. So we hope to interfere with these molecular pathways to block lymphadegenesis and improve graft survival. And also, we also collaborated with other people outside the eye to try to apply the results from the corneal study to other fields, such as cancer metastasis and also lymphedema. And we also studied the interaction between the nerves and the lymphatic vessels, and also the nerves and the blood vessels and the lymphatic vessels. So in the immune reflex arc, the lymphatic vessels mediate the traffic of the antigen-presenting cells from the tissue to the draining lymph nodes, and then activate T cells there, and then the activated T cells going back to the graft by the blood vessels. So theoretically, if we block the lymphatic pathway, we can improve graft survival. This is a study we published about 10 years ago, and this is the very first study to show the importance of lymphatic vessels in the transplant rejection, and it's among all the tissues and organs, and it was later approved in other kidney and the other major organ transplant rejection too. And this is another pathway we studied. So this is VLE1, it's integrin alpha-1 beta-1. So we found it's expressed in lymphatic endothelium cells in culture, and if we block this gene pathway, we can suppress lymphatic endothelium cell functions of adhesion, proliferation, and tube formation. And if we injected blocking antibodies, we can suppress corneal lymphadegenesis in vivo. So based on this data, so we move on to this high-risk corneal transplantation. So in this case, we induce inflammation and vessel formation in the cornea before we do transplantation. And by combining blockade of both VEGFR3 and VLE1, we were able to improve the graft survival from only about 10 to 20% in the control group to up to 90%. And at our time point studies, the transplant in the treatment group is much clearer than in the control group. So we also followed all the transplant in both treatment and the control groups, and also in the survived and the rejected ones. And we found high association between lymphadegenesis, as shown here, is reaching the border with transplant rejection. And in the survived ones, there's no lymphadegenesis. And this was also confirmed in another group of study. So we know in the black 6 mice, there's a very high rejection rate compared to the biopsy mice. So we also found there's a high rejection of black 6 mice associated with lymphadegenesis. And this is another study. We try to do a gene analysis, and this is RE-seq. And we try to compare different groups and try to isolate the genes responsible for this phenomena. So this is another pathway we studied. This is NG2 in this case. And this mice has, in this knockout mice, they have a lymphedema as shown here. And in the cornea, this NG2 was expressed on newly formed lymphatic vessels and also a macrophage. And in this mice, what's more interesting to us is there's no lymphadenogenic response. So no lymphatic vessels are formed in this mice cornea. And the blood vessels are formed, but in a less degree, and also it's very disorganized. So another direction of my research is also, instead of prevention of lymphatic formation, also try to induce regression. And when I started to work in this field, there's no model to study lymphatic regression. So one of the model I think of is in the hyaloid vascular system. So this is a system only exists in developed eyeballs, so they regress when the eyeball become mature. So we studied this whole, in human, if this vascular system didn't regress, so it can induce blindness. And we studied this whole embryogenic stage of this vascular system, and we found the LAV1 expression in the vascular system. So we hope to use LAV1 as a marker for lymphatic vessels in most cases. So we try to use this system to study the function of the LAV1 in this vascular regression. So the other model I think of is the cornea itself. So we know the adult cornea doesn't have any lymphatic vessel to start with. And one question we ask about, is it possible that before the cornea become mature, there is lymphatic vessels, and for some reason they regress, and to allow the cornea become mature and transparent. So we found this is embryonic cornea, postnatal stage cornea, and there are lymphatic vessels there, and before that, there's no vessels. And this is adult cornea when we induce the lymphatic vessels back into the cornea by just putting a suture. So taken together, this means the cornea has a full range of lymphatic plasticity from formation to regression. And we're trying to compare this physiological formation regression and the pathological formation, and hopefully we can, by comparing this formation and regression phases, we're able to isolate the mechanisms we can use to induce regression. So the other study in my lab is trying to see when is a good time point to interfere with lymphatic regression at different stages. So what we found is by combining blockade of both R2 and R3, we were able to suppress lymphadegenesis at both early and the middle stage, almost to the same degree. However, when it's too late, it's not possible to suppress them. And for blood vessels, this effect, we can only suppress the early stage of blood vessel formation. So this leads to another study. So we found that actually the lymphatic vessels in the cornea are not at the same stage. And as lymphadegenesis progresses, there is a formation of these valves, and these valves are formed inside. The numbers increase, and also as I show here, at the early stage, the cells come to this plate, and then at later stage, they become mature. And they were more located in the branching side, and also by following all the directions of the valves, we found that they are about 90% of the valves are formed in the direction allowing this fluid to traffic back to the limbus area. And this is another direction of my research, because clinically there's no method to identify lymphatic vessels in the cornea. So we come up with this method. This dye only get into the lymphatic vessels, not to blood vessels. And we were able to observe this lymphatic vessels. This is where we put on sutures. This is where the lymphatic vessels in the cornea. And also, this is a very high resolution system. We can observe the lymphatic vessels from different angles. And using the system, we're able to follow the formation and also regression of the lymphatic vessels in the cornea. This, as demonstrated here, this is a 4-month study. So within 2 days in the progression phase, the lymphatic vessels progress from a single cell into a complicated network, and then this is a gradual regression. And also, we're able to use this to do drug study. So this is a testing of one of the anti-cancer antibodies, and we show by systemic injection of this antibody, we're able to suppress lymphadenogenesis in the cornea. And combining these technologies, we are now able to study the function of the valves in the cornea, as demonstrated here. So this is one of the dye injected into formed lymphatic vessels in the cornea, and within 15 minutes, this dye disappear, and we then harvest tissue, and we found along these vessels, there is this formation of several valves, and they're there to direct the lymph flow. And the other tool we have is this newly developed transgenic strain of the mice. And in this mice, all the lymphatic vessels are shown in the green fluorescence color. As shown here, this is the lumbus vessels, and this is where the corneal transplantation, the border, and the formation of all the vessels into this border area. And also, we were able to observe both blood and the lymphatic vessels at the same time in the same cornea. And with this technology, we observe the progress of lymphadenogenesis. This is a normal cornea, and this is 11 days after transplantation. We see the formation of lymphatic vessels, and also inside these lymphatic vessels, there is a gradual increase of the valve formation. And this is a closer look to this area. You see this. In this area, there's no valves, and then there's a gradual formation of valves, and the number also increase. And I also want to mention the corneal lymphatic research has broader implications. This is the study. We collaborate with a lab. They work on the lymphedema study. And we show that by implantation of the non-cis retinoic acid inside the corneal stroma, we're able to induce lymphadenogenesis. And then they go back to their model of wound healing and the lymphedema. So it shows by injecting of this molecule, they can reduce the lymphedema in this wound healing model. And this is another study. While doing this corneal study, we found this one of the molecule that can be used to identify lymphatic vessels in the cornea is also expressed in the RPE cells. And by knocking down this gene in the RPE cells, we were able to suppress cell-cell contact and also proliferation. This is another study. We collaborate with a group in the Swiss Federal Institute of Technology, and they are interested to use the cornea to screening for the drugs that is currently in the market that be able to suppress lymphadenogenesis. So this is a demonstration of this is a cornea. So it's pretty hard to tell the difference between the control and treatment group. This is in the skin cross-section, because the skin, normally they have background vessels. And in the cornea, it's a pretty clear demonstration that by doing this, using these drugs, we can suppress lymphadenogenesis. And this is one of the most popular selling drugs to lower cholesterol. And by doing corneal research, we also came to the novel finding that actually at the angular structure, the Schlemm's canal, they express the lymphatic PROX1, which is a mass control gene for lymphatics. And here shows in the front, this is limbus vessels. And in the back, this big structure is actually the Schlemm's canal. And so this related to the corneal research to glaucoma, because Schlemm's canal is the major structure involved in the outflow pathway of the aqueous humor. So as shown here, we also demonstrate by induce inflammation in the anterior chamber. The lymphatic vessels in the limbus vessels, they can sprout into the central cornea, and the background and the structure, the Schlemm's canal in the back, they stay quiet, and they don't seem to sprout. And this is a confocal image to show in the front, in the top. So the structure is the lymphatic vessels, and in the back is the Schlemm's canal. I would like to acknowledge the contribution of the students, graduate students, and postdocs in my lab during the past few years, and also thank you for your time. Yeah. Yes.
I was curious about the protocol that you mentioned.
Yes.
You said that there was a loss of cell-to-cell contact. What is the consequence of that? What is the consequence of that?
I think that be involved in the RPE disease because we are not expert on that one, but because when we knocked down this gene, we found this one of the molecule for this Z01. This is a tight junction molecule, so there reduced the expression there. So
you never look long term to see what the consequence of the loss is?
No, I think it would be good to move to the animal model to see what happens in vivo. Yeah, thank you.
Now